Welcome to the St. Elizabeth Facebook Live. Have you ever wondered what would happen if you thought you were having a heart attack and then called 911? Well, today we will be sharing with you a realistic reenactment of what would happen during a heart attack response. While the video we will be sharing is a drill that we filmed a couple of weeks ago, it is a realistic picture of what would actually happen during a 911 heart attack symptom event. So we will be providing a live narration, and I'd like to introduce our panel of experts. To my immediate right is Jake C., firefighter from Alexandria. He will be the star of our program today. We would like to thank Jake and the rest of your department for all of the help in producing this. To my left is Dr. D.P. Suresh, cardiologist and medical director of St. Elizabeth Heart and Vascular. To my far right is Josh Ishmael, EMS Community Outreach Coordinator for St. Elizabeth. When we begin, you will notice a clock at the bottom right-hand corner that will time our event from the first medical contact in Alexandria to St. Elizabeth Edgewood. Can you guess at how long this is going to take? Drop your comments and your guesses below. I'll give you a hint. Google says it's a 25-minute drive. Feel free to ask any questions, like, share, tell us where you're watching from, and we will try to get to any of your questions as we go through.
Partner, what's going on today?
I'm just real short of breath.
Real short of breath? When did it start?
Oh, probably about 15 minutes ago.
Alright, you having chest pain too?
Oh yeah, my chest pain really hurts.
So it started about 15 minutes ago?
Yeah.
Been feeling fine the past couple days?
Yeah. I'm
Feeling normal?
Yeah.
Okay. Have you had any kind of medical history?
No.
Alright. We're gonna get you on a bunch of stickers and take a look at your heart, okay?
Okay. Oh, my chest hurts.
Is he been acting normal?
Yeah, actually, I'm the one who called 911.
Okay.
He's just been super sweaty and pale.
I'm having a hard time breathing.
We're gonna get a bunch of stickers on you. If you want to go ahead and get the cot, and it won't.
Jake, can you explain what you're doing with the sticker placement and what test this is?
This is a EKG, which is short for electrocardiogram. Basically just takes a picture of all the different aspects of the heart and takes a look and sees what's going on electrically.
And how long does this test take?
It typically takes a couple minutes. The longest part is putting all the electrodes on to get the picture of the heart.
Is there a specific placement that you are going with?
There's a specific place that all the stickers have to be placed to get the proper picture.
Dr. Suresh, how accurate is this test?
So the EKG is an extremely accurate test in terms of finding out if the patient is having a heart attack.
So you can really tell from this test if someone is having a heart attack. And why is this so important right now?
The test is accurate for a specific kind of heart attack in which the artery closes suddenly. And the reason this test is very important is because all the decisions we take in terms of managing the patient is based on the initial EKG.
I would like to point out that the clock is a little over 2 minutes and the patient is already being diagnosed. And if you are just now joining us, we are showing a reenactment of what happens when you call 911 when you are experiencing heart attack symptoms.
Looks like you're having a heart attack, okay?
Oh,
So we're gonna run you over to the hospital and get you treated, okay?
okay. Oh, I'm having a hard time breathing.
Alright, we'll get you on some oxygen when we get to the ambulance, okay?
Jake, how did you know it was a heart attack, and what exactly are you looking at?
There's once you put all the electrodes on and the the monitor does its printout, you can look at the EKG and look for elevation in certain leads that are consistent with findings that you would find with someone having a heart attack.
Can you talk to us about the difference between a heart attack and cardiac arrest?
A heart attack, obviously your patient is conscious and talking with you. Someone who's in cardiac arrest is not going to have a pulse. They're not going to be talking to you and not breathing at that point.
Okay. And Dr. Suresh, can you talk to us a little bit about how we measure time to treatment for heart attack patients?
So when somebody is having a heart attack, the most important thing is to act fast and try and open the artery that is involved in the heart attack. And what we say is from the time of first medical contact, which is actually the point where Jake and his colleagues go in, see the patient, we start our time from that point in time till the patient comes to the hospital and we open his artery.
So why is time so important?
So time is important because time is muscle. Every minute the heart does not see blood supply, the heart muscle starts to die. So the sooner we open the artery, the lesser the heart muscle suffers.
Is there a benchmark we are looking to beat?
So the national guidelines tell us that from the first medical contact to the time you open the artery is about 90 minutes. But our goal would be we should be from first medical contact to treatment or opening the artery should be less than an hour if possible.
Okay. And from the hospital side, what is the benefit of already having this diagnosis?
The benefit actually is more for the patient than the hospital because once you make the diagnosis, the patient bypasses the whole emergency room and the system of care. So directly the patient comes to the cath lab where we could open his artery for him.
Okay, and I would like to point out that the clock is almost at 6 minutes and the patient is being loaded into the ambulance and has medical treatment happening.
I'm going to give you 4 baby aspirin here, okay? You think you choose up for me? Oh, I missed one. On a scale of 1 to 10, 10 being the worst pain you ever had, how would you rate it?
This is at least an 8. Oh, this really hurts.
What's your first name?
My name's Bill.
Bill? Bill, what's your last name?
Smith.
Smith?
Uh-huh.
And what's your birthday?
6/24, 1961.
1960. You're 57?
Yes.
Alright, you said this started about 15 minutes prior to you calling us?
Yeah.
You're gonna take a picture of this EKG here and send it to the hospital, okay?
Okay.
Dr. Suresh, can you explain why Jake gave him a baby aspirin?
A baby aspirin given in the presence of a heart attack is something that's very important because aspirin essentially tries to break up the clot that's forming inside the person's artery. And when somebody has a heart attack, there is something in the blood called platelets that get sticky and form the clot. So aspirin actually works against this platelet and prevents the blood clot from happening.
So would you recommend someone taking a baby aspirin on their own after calling 911?
Absolutely. Anybody who thinks that they may be having a heart attack should immediately take aspirin to help them prevent the heart attack and make the heart attack symptoms better.
Should they take a normal dose of 2, or what would you recommend?
So the ideal treatment is to give 325 milligrams of buffered aspirin that the patient can actually chew so that it immediately has benefit to the patient in terms of his artery and his platelets being less sticky.
Thank you. So, Jake, can you explain what you're doing with your phone, and what app did you pull up?
It's an app called Pulsera. It is basically a way of communicating with the hospital. I can send the EKG directly to the hospital, and the cardiologist, along with the ER physician, along with the hospital staff, everyone will get the EKG immediately, and we're able to communicate back and forth through the app, as well as any additional things that they would like to, additional images I might need to get, or things in that kind of nature.
So, Dr. Suresh, can you explain how the Pulsera app works from the hospital side, and how has this helped the hospital?
So the Pulsera app is essentially very vital in terms of taking care of our patients because it reduces the treatment time for me to take care of the patient in terms of opening his artery. And what the app really does is the EKG that's taken at the bedside is immediately sent to me. I look at it, I decide that the patient's having the heart attack. Immediately the team is mobilized so that we could take that patient to the cath lab and take care of him sooner.
So you would recommend calling 911 instead of driving yourself or having someone else drive, because they would not have this type of this medical attention?
Absolutely. I think if you ever think you're having chest pain or having a heart attack, you should call 911. You should not transport either yourself or a family member to the hospital, because 1/3 of patients who present with a heart attack actually die from the heart attack still in North America. So trying to go to the hospital by yourself is not advisable.
Josh, can you talk to us a little bit more about what the Pulsera app means?
Yeah, so it's done our agency and our community a great service, and basically to sum it down in its simplest form is, with the application, your job is to create a patient channel, a dedicated patient channel, and then from there you can build a customizable team. If Dr. Suresh isn't on today but one of his colleagues is, we can add the other cardiologist, and then once the customizable team is built, then we have the flexibility to communicate. And that communication starts in the field where Jake is, and goes all the way through to the hospital, to the cath lab where this patient needs to be most. So it creates a channel, you build a customized team, and then you just get out of the way and communicate bi-directionally. It's a nice tool to have.
Thank you so much, Josh.
Pain any better, worse, about the same?
It's about the same. It
About the
really
same.
hurts.
It hurts. That aspirin still hasn't helped any?
No, not at all.
Alright, I got this IV now. I'm going to give you a nitroglycerin, okay?
Okay.
Dr. Suresh, what is the medication Jake is giving him now? Is this also an aspirin, and what does this one do?
Nitroglycerin is a medicine that is given to patients who are having chest pain syndrome and having maybe a heart attack, to open the artery, because it's called a vasodilator, which means it makes the artery bigger so that in case blood were getting stuck in it, the artery reopens. So nitroglycerin is given for pain control in the presence of a heart attack and also to loosen the artery and make blood flow better.
Again, I would like to point out that the clock is a little over 13 minutes and the patient has received medical attention and is in the care of a medical professional while the cath lab is prepping him to arrive.
The hospital knows we're coming. See his arm here one more time. We're gonna get him lower.
Oh, my arm hurts.
Your arm hurt?
Yeah.
Which arm?
My left arm.
Your left arm? Do that. Do you have your driver's license?
Yeah,
Where's it at?
it's in my pocket.
Okay. Which pocket?
My rear pocket.
Okay.
Uh,
The hospital wants your picture or your driver's license so they can go ahead and get you registered.
okay.
Josh, Jake mentioned getting registered. What is the process of getting the patient registered with Pulsera? How does it help right now? And can you explain how the app helps with this entire process?
Yep, so everything we do at St. Elizabeth is centered around the patient. The patient that's in the back of Jake's ambulance is having a time-sensitive emergency. So this is just another way that we can save time, save the patient's heart along the way. The emergency department has really streamlined the process, and they do a task that's called Quick Reg, where just with a couple clicks they can get the patient registered based on the information that Jake sent just a few minutes ago. We can also look at old EKGs that may be in the patient's record. So this is much more powerful than the telephone call that we used to do years ago.
Josh, can you talk to us a little bit about the safety of the app? Is there any idea or is there any way for people to get this patient's information other than the people who need it?
Yes, this is a very sensitive topic, but one that we all have to be serious about. The patient's privacy is paramount, and this app is HIPAA compliant. It's much like mobile banking. It can be compared to that. So nothing on this app is shared with anyone who's not on the team that we built earlier. Only the important stakeholders that need to know get this information, because we feel that it's very important that the patient's privacy be protected at all times, even in the case of an emergency. So everything is HIPAA compliant and protected.
Thank you. Jake, can you talk about the stickers that you are putting on the patient right now? How do those differ than the stickers you put on before?
The stickers I just put on, those are defibrillator pads. If the patient were to go into a dysrhythmia, such as ventricular tachycardia or ventricular fibrillation, we can go ahead and immediately shock the patient back into the correct rhythm at that point. It's part of our protocol now. I'm just telling the hospital we're going to go straight to the cath lab, okay, partner? We're going to take you straight to surgery so we can get you fixed, okay?
Okay. This hurts so bad.
We're going to give you another nitroglycerin, okay?
Sure.
See if that helps, okay? And after that,
Dr. Suresh, can you talk a little bit about the procedure this patient will have and to stop his heart attack?
So right now, the patient coming into the hospital with the heart attack has been recognized with the EKG showing ST elevation. The Pulsera has basically activated the team. We're already waiting for the patient in the cath lab. And what we do in the cath lab is we access an artery in the patient, usually from the wrist or from the groin. And then we take pictures from that. We pass a smaller catheter which goes up to the heart, and we get images of the arteries in the heart. So when we say heart attack really means they have closed one of the arteries that supplies the heart muscle. So let's say of the three major arteries, he has closed the right coronary artery, or the artery that supplies the bottom portion of the heart. That artery's blood flow is completely not there, which is why he's having pain and all these symptoms. So after getting the pictures, we use medications, and then I use a small wire to wire that artery, and then subsequently we put a balloon where the blockage is. The balloon is inflated, and then immediately blood returns to the artery. And in addition to that, what we do is to keep the artery from reclosing, we put a piece of metal which is called a stent, and that stent stays there so that the artery doesn't close, and we have literally aborted the heart attack. And if a patient comes early enough, usually within the first 90 minutes of them having symptoms, literally we could open the artery with very little damage to the heart muscle long term when you look at them.
So how quickly does the treatment work and help alleviate this patient's pain?
So as soon as we open the artery with the wire, the patient's pain literally within a few seconds goes away, because the pain that the patient's experiencing is actually the heart muscle dying, and it's telling us something is going on and he's got a lot of pain. And once you open the artery, the pain, the blood flow reopens the heart muscle again, and it starts beating better, and the pain goes away.
You talked a little bit about the symptoms that our patient was having. Are there other symptoms of heart attacks that patients may experience? Are there early warning signs? Talk to us a little bit about that.
So the most important thing to realize in symptoms of a heart attack is less than 1/3 of patients actually have true chest pain. A lot of patients actually may be just short of breath. Women tend to have different symptoms. Men tend to have different symptoms. The symptoms can be a lot of times just feeling really tired, difficulty in breathing. They were doing something before. Suddenly in the middle of the day, they are not able to do anything. They feel they're going to pass out. They also have some uncomfortable sensation in the chest. Trying to look at chest pain alone is a problem, because most patients don't come in with chest pain. They come with multiple other symptoms. So the most important thing is, if you think you're having a heart attack, trying to get medical attention is something that is very important.
Thank you. So I want to shift gears a little bit to a new thing that I've heard, hands-only CPR. Josh, can you talk to me a little bit about hands-only CPR, and can you tell me what it is and how this would help our patient as they would wait for an ambulance to arrive?
Yeah, so over the recent years, the American Heart Association and others have really stressed to the civilian population, not the medical professionals per se, but for the civilians, to just do hands-only CPR. And there's a couple reasons for that. Historically, we would have to provide the chest compressions, but we would also have to provide the breaths for the patient that's not breathing and doesn't have a pulse. But as you can imagine, the general public was a little uneasy about providing the breaths. They didn't know this individual. They were a stranger. Maybe they had got sick prior to. So a lot of times people were focusing too much on the airway and not providing the chest compressions that really matter most. So hands only, that whole approach is just to reduce the stress and focus on what's the most important for this patient at this time, which is the chest compressions. So civilians that get trained now, we just reinforce the fact that it's push hard and fast in the center of the chest and call 911. Those are the biggest takeaways. And if you live in a rural community, we reinforce it even more because it all goes back to time. And if you're 30, 40 minutes from the hospital, that hands-only CPR, that temporary measure, can really make the difference when it comes to getting your organs, your kidneys, and your brain the oxygen it needs. It really does make a difference, and it's simple. It doesn't have to be scary. We can teach children how to do hands-only CPR.
So if someone thinks they could be having a heart attack, what should they do? How long should they wait before they take action?
It has to be immediately. Dr. Suresh alluded to the fact earlier that time is muscle. Every minute really does matter. We can't hesitate. We have to make the phone call to 911 right away because there's a team here waiting to fix this problem. So time is of the utmost importance. We can't wait.
Jake, can you talk to me a little bit about why it's better to be in an ambulance right now than rather than a private car?
Well, taking an ambulance to the hospital when you're having a heart attack, there's so many things we do in the back of the ambulance versus going in your private car. By the time we get to the hospital already has the first EKG. They have IV access. They've had the first rounds of medications they need. And a lot of the times we'll go straight into the cath lab and bypass the ER altogether, so they won't have to have any more EKGs or anything, and they'll go straight into interventional treatment, what they need to truly fix the heart attack.
So you mentioned not having to have any more EKGs. How many EKGs has this patient had while in the care of the ambulance?
I believe I've done 3 in this video so far, just to, because I'll do the initial one on scene and then several en route to see if there's any changes noted, if it's getting any worse, because we'll be able to notice that with more elevation and different leads.
So what would a change in his results mean?
It would mean that his heart attack's getting worse. So the blockage is getting worse, or there's another blockage forming.
The ambulance is much like a mobile emergency department. There's so many tools that Jake has at his disposal that you wouldn't necessarily have in your car. And Jake has with this Pulsera app, he has an ability to pre-notify the hospital, but he can also give real-time patient updates to the whole team at St. Elizabeth. You're not going to be able to do that from your car either. So the ambulance is definitely faster, but it's also safer for the patient and for the community. And in Northern Kentucky, we collect data on this, and it's nearly a 50-50 split in Northern Kentucky. 50% arrive by car, and another 50% arrive by Jake or local 911 services. We are really trying with our marketing teams and other colleagues to fix this number. It shouldn't be a 50-50 split. We have to reinforce the fact that 911 and the ambulance is the way to go versus the car.
Why do you think people want to take a private car versus an ambulance?
That's a very good question. I think there's a couple of reasons that come to mind first and foremost. One is the fact that nobody wants to think that they're having a heart attack. None of us want to think that. We want to attribute this pain and this discomfort to something else. We always want to minimize it and think it's just a GI bug, or I've pulled my back in the flower bed. None of us want to say that we're having a heart attack, so we minimize it and think the car is okay, when in reality there's a larger problem going on behind the scenes, and getting in a car is actually quite dangerous. Another is cost. I hate to mention that, but you got to remember, this ambulance ride will come with a cost, but it's there to potentially save your life. And you cannot put a cost on a life-saving measure that the ambulance only is going to be able to provide you. So cost is probably an issue. Denial is probably another issue. But we have to put all that aside for this moment that matters, and 911 is the answer.
Can you tell us, or if you know, are we improving our time to treatment at St. Elizabeth?
Yep, that's another very good question. And I can say we were one of the first healthcare systems in this area to implement technology like Pulsera. We've also changed our cardiologist on-call schedule. We've tweaked our cath lab scheduling quite a bit. And we're doing EKGs faster now for those heart attack patients that come by car. So it's Pulsera, but it's also a bunch of other internal things that have really improved our data significantly. We've gave presentations in Orlando just in December where we've seen time to treatment go down by EMS arrivals by 18%.
So Jake, now that we are in the hospital, can you tell me where we're going right now?
In this portion, we're headed back to the cath lab to get the patient directly into surgery.
So you got to completely bypass everyone in line at the ER.
Yep, the patient was already registered by all the information I sent via Pulsera. They sent a notification to me via the same app to bypass the ER, and we went directly into the cath lab at that point.
Can you guess about how much time is saved by bypassing the ER?
It's very patient dependent. If without getting an EKG in the ER, I'd say at least 5 to 10 minutes if they go directly from getting EKG to the cath lab at that point.
Hi.
Hey.
How you doing?
Good.
Hey, I'm Julie. I'm one of the nurses. We're gonna take excellent care of you. Let's keep going this. Can I get some report?
Started with chest pain about 15 minutes prior to our arrival. Chest pain, shortness of breath, center chest, crushing chest pain, not any other complaints. He had 2 rounds of nitro, 3.5 aspirin.
Okay. Can you tell me your name and date of birth, sir?
Bill
No
Smith,
change in
624,
he's
1961.
got an 18
Okay.
in his left AC. Vitals were all stable.
Josh, can you tell us what St. Elizabeth did to implement the Pulsera app? What was involved with getting this started?
Yep, so we brought Pulsera to the table in late 2015, and we really got serious as we entered 2016. We went live in June of that year of 2016. As you can imagine, there's a lot of pieces involved and a lot of different stakeholders. We've got to get buy-in from the EMS agencies, the cardiology groups, the emergency departments. All these people have to agree and see the value in this tool for this to work successfully. So we initially started out with a pilot of just 8 EMS agencies and St. Elizabeth Edgewood. We found that it was successful, so we regionalized it. And today, I'm happy to say that all 5 emergency departments and 30 different EMS agencies in this Northern Kentucky community are using this life-saving tool.
I would like to point out it was just 32 to 33 minutes from when the paramedics arrived to when he was being prepped for cardiac treatment. With the national benchmark at 90 minutes, our team is well under, even with a 25-minute commute from Alexandria to St. Elizabeth Edgewood. We would like to thank everyone involved and who helped produce this Facebook Live, and thank you to our viewers for watching. We hope you saw the value of calling 911 if you have heart attack symptoms and how this can help you with a better outcome.